of having this veterinary specialty. Okay, so of course, if you have any questions or any doubt at the end of the presentation, I will be pleased to answer it. I work in CRAR. We opened CRAR in 3 years ago, and since then we are becoming very, very important and we are working with a lot of other colleagues in Barcelona, because I think it's a very important thing to have as a complementary service. Because we are a complementary service. We don't do anything other than just doing rehabilitation. Okay, we don't we don't put vaccines, or we don't do anything of that. We just work in physiotherapy. Okay, so we are a complement for hospitals, clinics, and veterinary facilities. Okay, and our goal is to improve the mobility of dogs and cats. Okay, it's just that thing. So now we will discuss which reasons of consultation we can have, or you can think about of sending. In our team, we are veterinary surgeons and nurses specialized in physical therapy. Okay, so let's start. This is what I want to talk about. My goal, my objective is that why and when it's important to send a patient to rehabilitation. I will discuss it through some clinical cases. Okay, that I think that's the way that veterinarians like to learn. Okay, for me, let's see. Veterinary rehabilitation. I don't think it's a new specialty. I think it's a new needing, because nowadays, prevention and improvement of the well-being of the whole family, not just the father and the mother and the grandmothers, also the cat and the dog and the bird. They are a whole family, and it's important that everybody are okay and without pain and moving easily and doing what they enjoy to do. Okay, so for us, it's a must to starting to think about more in the individual and getting more specialized in every field of the veterinary care. And yeah, we are not superheroes, so we have to know where we have the limit, and it's important that we work together and enhance the reference. So me, for example, I don't know about a lot of about ophthalmology and about eyes. So if I have a problem with eyes, I will send them to the ophthalmologist. So here is the same. If you don't know how to make this dog to put the leg on the ground because it's still like 2 or 3 months and the NSAIDs are not working and the dog is not improving, yeah, just send them to the rehab physio or check again with the orthopedic, but don't stay there, because sometimes some veterinarians are very afraid to refer and to send the patients to another professional. And if you work together and if you work correct, this patient will come back. Okay, and I think it makes us a better clinicians and professionals to work in this way. And of course, veterinary physiotherapy is not magical and esoteric thing. It's a medicine. It's a evidence-based medicine. There are a lot of studies. Before, years ago, most of them are extrapolated from human medicine, but luckily there are more and more studies of course, in sports animal, and yeah, and every year they appear more and more. So it's a serious thing. Okay. And keeping in this, it's been a while that I don't hear this too much, maybe because they don't want to say to me, but I think there are still some veterinarians, maybe that they don't get actualized or they don't look further, but sometimes they just think like this, that this dog just walking is enough to rehab, that there are no studies, that in the physio consultation they just give 4 messages. It's not a serious thing. And this is more about neuro people. Oh, no, 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 don't go to physio, strict rest, cage rest, no physio, don't do anything. And I just want to say that rehabilitation, physiotherapy, it's not about make the dog move and move and move, or swim and put them in the water. It's about knowing about the physiology and how to improve but keeping the physiological states, or the physiological phases in mind. Of course, if it's already there is a surgery and they made an emilaminectomy 2 days ago, I will not put to walk and to go in a very heavy exercise. Of course not. But during the resting, we can do a lot of exercise to improve the neurological state. Okay. So behind the rehabilitation veterinary, there are associations, there are international associations, there are colleges, American college, the European college. So of course, again, if this is serious, it's not magic up. Okay. So let's go to the point. When is it necessary to think about, oh, maybe I have to send this patient to rehab? Let's keep this in mind. Any conditions that limit the locomotor capacity and physical well-being of the animal is likely to require rehabilitation. Okay, this is a huge variety of patients. Maybe just we need to control the pain in a neoplastic patient, or maybe is a puppy that is not moving quite well because he was I don't know, in bad conditions, in bad nutrition, and he has to recover the muscles. Maybe we can help him to gain more muscle easily. This is a huge, but think about this. Anything that limits the locomotor capacity and physical well-being is likely to require rehabilitation. Okay. So reasons on consultation. I think the most easiest one to think about is post-surgical recovery. This is the easiest one, and what we know that it's very important to send to rehabilitations, because in humans we do that. With these patients, we can help to shorten times of recovery. We can improve the tissue quality, not just to heal this leg or heal this bone and heal these muscles. No, that it will heal better, and also avoid adhesions of the cicatrization scar or the chirurgical scar. Sometimes it gets very tight and very in bad state, or you see that it's not healing correctly. And with rehabilitation, maybe just with massage or maybe with another electromedicals, we can help to heal better. This is on post-surgical, and sometimes there are another reason that we can see. It's muscle injuries. There are dogs, maybe sometimes very active dogs, or very when they tear very much the leash. Dogs that go very strong. Sometimes they get muscle injuries that with NSAIDs don't work, and the lameness does not go away, or it appears, or it goes away and it appears again after 1 week, and it goes away and appear again, and you are seeing this lameness for months and months and months, and it doesn't disappear. Sometimes you have to think about a muscle injury. For example, tenosynovitis of the biceps is very common, or for example, iliopsoas injury that sometimes is very painful and not easy to see sometimes. So, sorry. Sorry, 1 moment. You see it well? Again, sorry. It's okay.
Yes, Marina.
Yeah. Okay. I didn't know what that's it. Okay. So muscle injuries are very important and are sometimes they are not chirurgic and they just need rehabilitation. Okay. Another reason, very common in our clinic, is in our experience, is degenerative diseases, osteoarthritis the most, and it's very important to think about these injuries and these dogs. Most of them are senior patients, and sometimes as a generalist veterinarians, we think, oh, they are just old, yeah, just let them be. And I think if we take care of the mobility and the quality of life of these senior patients, will make us better professionals. And the owners of that dog or the family will trust you even more as a veterinary professional. So if we think about how is the quality of this dog, how they move, how we can feel him better, how we can make him live the last years of his life better without pain. So it's very important to think about this. Another reason that it's very, and I think this is the one that make us sometimes like, oh, they performed a miracle, or they are magical, or they are witches of the animals. Sometimes I hear something like that. No, it's not a miracle. It's just thinking about how the neurological system works. Talking about neuroplasticity, we will talk about later, and how they work and how we can use different exercises and different electromedicals to make that the neurological system work better. And after, if you stimulate the, the nervous system, it's that is magical, because neurological system is magical, because it surprised me every day. Okay. Another reason then that here we can talk about more about puppies or young dogs, is the preventing physiotherapy. Sometimes we have young dogs that they have hip dysplasia, low-grade patella luxation with 2 years. And yeah, what are you going to say to this family? Yeah, don't let him run for the rest of his life. I don't think that's a good advice to say. We can do a lot of things to make this dog live as much normal as a normal dog can live. Okay, so yeah, there are a lot of things that we can do here. And the last one that I want to talk to you, it's improve healing, improve cicatrization. Maybe this one is not known enough, but there are massage techniques and, of course, electromedicals such as laser, radiofrequency, magnetotherapy, and so on, that can help you to improve the cicatrization of some injuries or some wounds that are not healing correctly. And yeah, we will see one case of this. Okay. So just think. So the physio bed, me, for example, how we are, no, how we work, and what is the thing that we do. It's important in that the physio vet knows about very well the anatomy and the biomechanics of the dog, because it's very important to, and is an essential for me, to establish a correct plan. If you already know how this dog moves normally, or how the dog has to move, or how the cat goes through the environment, how the cat behaves with the environment. If you think about all of this, you will establish a very correct plan, and you will diagnose better. Okay, so the physio vet diagnose and develop the rehabilitation plan. After, we have the vet nurses and physiotherapists in animal physiotherapists that can help us to put the treatments and to work on this. But the plan and the diagnosis goes through the physio vet. Okay, so what we try to think about, what we focus, it's in the environment, in the activity, in the static position of this dog, in the motor pattern analysis, how he's compensated with the muscles, um, which is the proprioceptive status, where they have the pain. Maybe the origin of the pain is maybe a patella luxation, but already the dog has pain in the neck. Okay, so we have to treat the pain in the neck and the main problem that it's a patella luxation. Okay, but we have to think, and we try to think as a whole system. Okay, and how do we approach a case? What Where we start is the functional assessment. It's the first visit. It's the first time that we see a dog. We try to reach all the information that we can, as much information as we can. Okay. So first of all, an anamnesis, of course, as a normal veterinarian. Okay. What pathology that what's the reason of the consultation they are coming? What pathology already has, another pathologies in the past that they had, surgery technique, current and past activity, diet, medications, environment. And with environment, I mean this dog has to go through a lot of stairs every time that goes out of home, or maybe this dog lives with, I mean, 3 cats that they are jumping all the time and he cannot rest, for example, or it's a very stressful dog and they are with fireworks every day and he's very stressed, and sometimes maybe that's why he has back pain, for example. So all of this, it's a very important thing to take in account. Okay. After that, of course, the physical exam, biomechanical exam, neurological exam, orthopedics, and of course, palpation. We take a lot of information about with our hands, okay? And with all of that, we start to set up the goals, okay? Where we want to be in 1 week, in 3 weeks, in 1 month, and in 1 year, which is the goal. And with that, I want to talk about the expectations. It's very important that we discuss the expectation of the family, because if the goal is too far, for me, it's better to go step by step, because otherwise they will frustrate because they don't reach that farthest goal. And I will tell you an example. Once it came to me an 19-year-old Yorkshire Terrier, blind, deaf, he cannot move at all. He was tetraplegic with no ambulatory tetraplegic. He was with a very strong cognitive dysfunction. Yeah, it was a very old patient, and the woman wanted him to run away again as 3 years ago. I was saying, okay, I think this is a high expectation and it's not real. And I think it's important to discuss about quality of life. For example, this is an example, a very strong example. But we can think about all of this with the owner to see where we have to go and how we can arrive to this goal together and as a team. Okay. So we will set up a plan. A plan means, okay, 1 session per week or 2 sessions per week. We will do these techniques and these therapies, and we will discuss again. We will discuss home routines. I like to as a team too, to make the owner and the family. It's a very strong paper that they get very confident with us and be a part of the rehabilitation plan. okay? So it's important the exercises that they do at home. It's important if they have to rest or make shorter walks or even longer, or to avoid to jump on and off of the sofa, and exercises that we can send to them to do at home. Okay, so all of this we discuss it. And we will make some changes in diet, on nutraceuticals. Maybe we will give them supplementals for this pathology. We will discuss about the environment, maybe avoid the stairs, avoid the jumping, and avoid the activity, or make him walk longer. Yeah, some of that, okay? So what kind of therapies that we use? We use massage therapy, passive kinesiotherapy. Passive kinesiotherapy will be joint movements, stretchings, okay? Another therapies that we can work on is chiropractic and osteopathy. There are veterinarians that get specialized in this, and it's manual therapies that can make a difference in the evolution of these patients. Also, we have Chinese traditional medicine, acupuncture, phytotherapy, and so on, that can work very well in that kind of cases that you cannot use, for example, electromedicals as oncological patients. Active kinesiotherapy, here we have all the exercise that we can do. We can do it in assisting way, just with harnesses or peanut balls or whatever, or in a resistive way, maybe in the water treadmill, for example. And of course, the therapies that we can use too, it's all the electromedicals that we have. Laser therapy, radiofrequency, magnetic fields, electrotherapy, shock waves. That all of these therapies will help you to improve the results and shorten times. But for me, the most important thing is a plan, where the goals that we establish, and how with hands and with exercise can we go through that. Okay, the electromedicals help a lot, but if you don't have it, no problem. You can still do rehabilitation. Okay. So with all of these informations, we set up the plan, we set the goals, we set up the therapies and the guidelines to use, and we set up also the checkups. Normally, I see the one case in the first assessment, and then after 3 sessions, I check up again. And during these times, the patient is with the vet nurses, and following the plan I establish. And with all of this, we make a report and we send it to the referral center, and we keep them informed and how the evolution of these patients goes. Okay. So another question. When do I send them? When it's okay to wait? I already performed the surgery. Do I send them already? We can wait until 3 days. We have to wait.
Marina, sorry, you have the mic off. I don't know why. Your microphone is off.
Now?
Now? Okay, perfect. Yes. So
since when was off? I don't know. Since here,
yes.
It was off.
Yes.
Okay.
Yes.
Okay. Sorry. I don't know what touched it. Sorry. So again, when do I have to send this patient? It's important to wait 1 day, 2 days after the surgery. Do I have to wait the 2 months? Yeah, it depends a lot on the patient. It's not a easy answer to this question, but keep this sentence in mind. What does not move, it gets lost. Okay. So, of course, we have in mind the chronicity, the type of injury, the patient character, the family conditions, okay? But keep that in mind. What does not move, it gets lost. Okay, we will discuss it in different clinic cases, but keep this sentence. So we will see these three clinical cases: a post-surgical recovery, and a spinal cord injury. It's a avulsion of the brachial plexus, and an ulcer healing of the tarsal bone. Okay. So here we have Joni. It's a mixed breed of 9 years old, nurtured male. It's referred by a veterinary hospital of Balmes in Barcelona. He ruptured his cranial cruciate 2 months ago of the left hind limb. They perform in the hospital. They perform an extracapsular surgery with lateral implants after a few weeks of the rupture. So it didn't happens too many days. So after 3 weeks of the surgery, the dog doesn't still put support on the limb, and he was already on carprofen medication. It's okay? I didn't. Okay. Maybe it's a microphone.
Let me
Okay.
silence the person that it's with the mic on.
Okay.
Uh,
Okay. No problem.
okay.
I will put the video again. You see
Okay.
that. Yeah. Go on. Okay. You see that Johnny doesn't put a limb support, and he was a little bit overweight. Okay. So in this case, yeah, the answer. When do I have to send him to rehab? Okay. For me, this dog, if after 3 weeks he doesn't put the limb on the ground, we have the first thing that we have to keep in mind is if he's in pain or not. If the pain is controlled, send them to rehab as soon as possible, because we have to work on the motor pattern. Okay, we can work on this since the pain is controlled. Why I say that? Because if this dog is in pain because maybe the surgery didn't went well, or maybe the implant is not is maybe an infection, whatever. But if the dog is in pain, we cannot work on putting the limb on the ground, because he will be in pain and we will not see any improvement because he's in pain. Okay, so it's very important to keep this in mind. So, for example, this dog was on carprofen already. He was checked by his orthopedic surgeon, and he checked all the joints and so on, and the dog was not in pain. He was just that he had this motor pattern after 3 weeks. So, if we have the family in front of us, we are the generalist veterinarian, and how we can convince this family to go to rehab. So one of the sentence can be this one: it is common for small dogs to adapt to walk on 3 legs. So in the physiotherapy consultations, they will teach you exercises to support them again, and they will speed up the recovery on musculature more easily. Okay, just say that to your families, to your patients. Say, okay, this is a normal problem. That it's common that small dogs can do that. So just go there, and they will help you how to do this easily in more efficient way. Right? This is an example. So the functional assessment of this dog was a body condition score of 7 of 9. The dynamics: there is a lameness 6 to 6 of the left hind limb, compensation with the head, and a marked basculation with the tail. In the static positions, we see a marked weight displacement in the anterior third, a compensatory thoracolumbar kyphosis. And if we check the perimetry of the left hind limb, it's 18.7 centimeters, and the range of motion is 135 and 52. Normally, the flexion of the knee can be around 35. So Yeah, it's a shortened range of motions. There is a tension in the muscular sartorius and rectus femoris, and there are several trigger points in both pectorals. Okay, so there is a compensatory tension in the palpation of the paravertebral muscles. So, what are the goals in these patients? First of all, lose weight. He's so fat. No, we need to work on this body condition score. We have to control the compensatory signs. We have to reeducate the posture, okay, and to, of course, improve the weight bearing of the left hind limb and reeducate the gait. Okay, how we do that? We start with laser therapy and radiofrequency sessions because laser therapy increases cellular energy production in the joint. We activate fibroblasters, so we will have higher quality of the collagen. We will release perform substances, endorphins, and the substance P will be reduced. So we will work on the increased pain threshold. And the radiofrequency will help us allows to reestablish the cellular electrical activity, so the tissue will work better in a good environment. And combined with manual therapy, we will increase the success of joint contracture management. So we will help with the flexion and extension and with the stretching of this leg. Okay. And very important, to work on posture reeducations. So the motor gesture is just when he's standing, he has this gesture and these positions. So if we work on this, if we control this, we must reeducate the rest of the body. The weight shift, we will do it by weight shifting, putting the dog in steps and displace the center of gravity to the hind limbs, giving the paw. So we will work a lot with isometric contractions. We will work on the treadmill, and the home routines are very important in this case. Well, in all of the cases, but in this one the family was very they work very well. So this is Johnny in the treadmill. So the treadmill forces the dog to keep working and to stretch the legs. So I think it's a very useful machine. This was the first sessions in the treadmill after he was doing it better. See, he's still lame, but you will see the atrophical, the muscular gain was even higher in this last video. And here is the weight process. He was losing weight. It was very important to do that. And we performed 6 sessions in total. First of all, 2 sessions per week, and the last ones were 1 sessions per week. And with all of these sessions, we improved a lot the flexion of the knee. So what is very important in this case that this dog was living in Menorca. He was not living in Barcelona, and this dog after 1 month and a half, they told me, we have to go to Menorca again, and this dog has to walk. So we were like in a hurry to make him walk better. And this was a video in March after several weeks. So he was still walking normally, and in September, so several months after, he was still walking better. I don't know about body condition score, but the effects at least last over time. So for me, it's a successful case. Yeah, he was here running. Okay. So now we are going to talk about the neurological case. This is Toby. It's a dachshund, a tekel. We say tekel in Spain. It's 1 year old. He was a male, and he was referred by mi vet Anibalia. He was hit by a car 1 month ago, and he developed an avulsion of brachial plexus. They treated with corticosteroids. I don't remember how many days, I think 1 or 2 weeks. And after 3 weeks, he maintained a left forelimb without support, and it didn't have sensitivity in the lateral fingers, and there was a strong muscle atrophy. You see. Okay. He was a very strong character dog. So in this case, when do I have to send him to rehab? So for me, in cases of decreases in sensitivity, so it didn't have sensibility of the fingers, the sooner as possible to start the rehab. Okay, here if the patient has to keep a strong resting, okay, keep a strong resting, but we can work on sensitivity. We can do laser, we can do radiofrequency, we can do acupuncture, and that doesn't imply to make an activity or not doing resting, but it's important to work on these patients as soon as possible. Why? Because the nervous system has mechanisms to recover its functions in irreparable injuries due to its plastic properties. It must be stimulated and trained properly. It always surprises us, is what I told you before. So the neurological system, if you stimulate it, they will respond. If you don't stimulate it, you will lose him. Okay. So the functional assessment of this dog was a body condition score 5 of 9. There was no supporting the left forelimb when he was standing. There was a monoparesia, and there was a lameness, of course. And he by the other hand, he uses the limb to play with other toys. So he was like moving like this. But when they took him for making short walks, they appear crawling ulcers and self-mutilations because of the knuckling. The neuro exam shows the postural responses were present. The replacement don't. There were the reflexes of the triceps and the biceps were present. The biceps, yeah. The flexor reflex presented in all fingers except the 5th and the 4th finger. And in the time that we assessed him, there were sensitivity. Okay, so that's a good thing. So what's the diagnosis in this case? For me, will be more a neuropraxia or a axonotmesis. Neurotmesis less probably because we keep the sensitivity. So this is we have to keep in mind what diagnostic we have. So the goals, what will be? Promote neuronal regenerations, increase muscle trophism, and again, gait reeducation. Normally, the neuronal tissue growth is approximately 1 to 2 millimeters per day. So if this is a table that we can see what kind of grade that we have depending of the sensibility that we have in this case. So for me, again, I think was more about a neuropraxia and axonotmesis. So we have to think about this very well to discuss about expectations and prognosis. So for me, in this case, an improvement is expected between 1 or 2 months. Sorry. So if after 2 months of rehabilitations we don't see any other function or any other improvement, the recovery of the distal radial nerve function is unlikely. So then we will discuss about corrective orthosis or arthrodesis to avoid the knuckling ulcers. But we can expect a recovery, okay? So this is about the neuroplasticity. If the neuroplasticity is the ability of the nervous system to modify its structure and function as a result of experience or development. So if we incorporate this in the rehabilitations, we will see a very more comprehensive recovery. Okay, so if we stimulate the nervous system, it will respond. If not, you will lose it. So stimulate, stimulate, and stimulate. In this case, we put 2 or 3 sessions per week. We perform a laser starting at 6 joules in the brachial plexus and then in the nerve path. We use also pulse electromagnetic fields. We use electromuscular electrotherapy. I know, and in this picture is not a dachshund and is not in the front leg, but I didn't have a lot of pictures of this dog. It was a very strong dog. He was not very friendly, so we have to put all the hands in this dog to rehabilitate him. And we use also the treadmill and proprioceptive circuits. Proprioceptive circuits can be something like that. You see, he has to think about if we put a lot of obstacles in his way, he will have to modify his body to put the leg on to keep walking. So this is a thing to make him think about how his body posture and his proprioceptive status is. Okay, and also we perform swimming. I didn't have videos, but he was swimming, so we can work on the motor pattern. Okay, so after 2 months later, he tolerated walks for 1 hour, but after that he shows a little bit of fatigue, so we have to keep in mind. He does not get knuckling with wounds or bites. He was still on lameness or 2 of 6, but you can see that he's putting all the weight on the left one. The weight download was okay. I put it on Spanish, is the left forelimb. There is a normal neurological exam, and the wearing of the nail were more symmetrical. So we discharged him. He was already recovered. Okay. So the last clinical case, very, very fast. It's a papillon. It's an ultra nail. He had a fracture in the 2nd and 3rd metatarsal, and after 1 month with a splint and 15 days with a bandage, the fracture was consolidated, but there appeared an ulcer, and she was in need of healing routine every day. She went to the vet every day to make healings, but there was not improvement of the ulcer. And as you can see in the video, since the removal of the spleen, she didn't put weight in the left hind leg. So yeah, this is another reason for rehabilitations. Yeah, the fracture was okay and so on, but there was a healing, a ulcer that was limiting his mobility. So again, we can send these patients to rehab, and why? Because it's very important to, in front of immobilizations, the production of proteoglycans and the synovial fluid is diminished, and there is a greater disorganization of the cartilage. So if this dog keeps not putting this leg on the ground for several weeks, we will have chronic pain, maybe in the low back, or it will have irreversible effects in the joint level, for example, and maybe she will have more difficulties to, she will have more, I don't know how to say it. Maybe she has more papillates or more opportunity to have arthrosis on the knee or whatever. Okay, so another injuries on the knee, for example. Okay, and of course, an atrophied muscles gradually lose their capacity and become stiff, and again, which can lead to chronic pain and discomfort. Okay, so it's important that this dog put the limb on the ground. So on the functional assessment, the body condition score was 6 to 9. There was a lameness, again, a compensatory scoliosis with altered motor gesture, and the ulcer was deep in the tuberosity of the calcaneus. It was a 1.3 centimeters. The appearance was okay. The tissues were nicely pinky and so on, but there was an exposure of the superficial digital extensor tendon. The palpation of the tarsal metatarsiophalangeal joint shows no pain or limited ROM, so it was moving easily. But we detected already in the left quadriceps very tight and trigger points and tension. So the goals, what will be? Increase healing of this injury and treat postural changes and gait pattern. This is a different studies that we have in laser therapy. There are a lot, but I think in this case, the laser therapy, it's very important because it helps to increase the oxygenation and the cell metabolism. Okay, so there are several. If you want, I can send to you. But one of the effects that we see a lot in laser is that it inhibits the bacterial proliferations, and the soft tissue gets 80% stronger in this study and in one tensil in diabetic murine model. So I think it's very important in this case to have some laser or at least massage or do something to improve this delayed healing. So in this case, this was a progression of just 2 weeks. We started on the 3rd of May. I think it was the second session, and we discharged this dog in 18th of May. You see the progression of the ulcer. And at home, the routine at home were weight shifting, haute slalom. Haute slalom will be to do an slalom, but in haute. So we do 3 cones, and we do slalom, 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 and all the time that he has to turn 360 grades, it's all the time in the left hind limb. Okay, and tripedestations means that the dog is in quadrupedia, and you ask him to give the paw, so it has to discharge the weight on the hind limbs. So this is just to tell you that also rehabilitation is preventive. So in cases on hip dysplasia, you can work on. This is just a case that I like a lot to share. This dog was in hip dysplasia, young dog. We start with laser, pulse electromagnetic field, massage. We start with underwater treadmill, but we have to stop it because the skin allergy. You can see that this dog has very strong difficulties to work very well. You see that both hind limbs are medialized. He doesn't put too much weight on both hind limbs. This is very kyphosis thoracolumbar brachis. And we work on active kinesiotherapy, cavaletti, squats, slaloms, core exercises, weight shifting. We develop a very strong plan, and at home they work a lot with these exercises. And after 2 years that we didn't see this dog, sorry, I will put it from the beginning. Like this now. You see that this dog was with more he gained a lot of muscular tone. Now it will come back. You see how he's moving, how his posture of the spine, and yeah, it was a normal dog. Yeah, he had hip dysplasia, but he was already a normal dog. Okay, so just for finishing, remember, prescribe. Okay, prescribe the rehabilitation. Don't wait that the family of and the owners of your patients ask you to do more. So prescribe the rehabilitations. They trust you and they trust your criteria. If you say that it's the thing that you have to do, just say it. Manage very well the expectations, because we don't have a magic ball. So I recommend to go by goals and step by step. And of course, if there is no improvement, perform a checkup. Sometimes something is not going well, and you have to, and something is going wrong. So do a checkup. Don't get afraid to do that. And remember, the main goal is to improve the quality of life of your patients. Okay. So I don't know how to pronounce this. Labai Asiu. Probably I didn't say it well. So thank you so much. If you have any questions, I will be here. Otherwise, you have my email there.
Thank you, Marina. Thank you very much for your nice presentations. Ausra,
Thank you.
do you want to go ahead with questions?
Yeah. Again, yeah. Go ahead.
We have just one question about massage.
Okay.
Should massage be held to do skin allergies too?
Yeah, sometimes massage, if you have a patient that has a skin allergies, or he's already in for example, in skin infections or so on, yes, don't do massage, because it can get worse. I don't know if it was the question or I answered it well.
Jeigu kas turit klausimų, galit ir paklausti. Įsijunkit mikrofoną, tiesiog ir paklauskit. I think we don't have more questions. No? Thank you very much for your time.
Thank you so much. I hope you find it interesting. And
yes, for me it was quite interesting, and I hope for our vets it will be interesting too, and they start to make a more these things, rehabilitation for patients. And we have already quite a new clinic with all these procedures. So
nice.
Yeah,
that's nice.
Ir dabar, and thank you, maybe Rolandas will start his presentation. And ačiū visiems už jūsų dėmesį. Dabar dar truputėlį mūsų kolegos Rolando trumpa prezentacija ir visi galėsime eiti į vakarą ir leisti savo pailsėti nuo darbų.
Okay, bye.
Thank you, Marina. Bye.
Okay.
Thank you.
Thank you so much.
Rolandai, mikrofoną tik įsijunk ir laukiam tavo. Taip, ačiū.
Sveiki, labas vakaras, viskas matosi?
Matosi, viskas girdisi.
Gerai, super. Tai aš šiandieną stengsiuosi jūsų labai ilgai neužlaikyti. Trumpai pakalbėsim apie pašaro sudėtis ir jame esančius ingredientus, kurie yra, sakykime, labai reikalingi ir netgi būtini augintiniams. Tai pakalbėsim trumpai apie glikozamino naudą, tai yra sąnariams, kaulams, dėl metionina, L-karnitiną, ypač tai kalbant apie sterilizuotas kates, taip pat aptarsim omega-3, omega-6 naudą. Sterilizuotos katės. Šiaip atsiprašau, biškutį man Matosi, man kažko labai striginėja.
Mum tai matosi. Gal nepilnas dabar, nepilnas full screenas, bet matosi.
Taip pat. Pabandau padaryti full screeną. Tai va, dabar full screenas, ne?
Taip, matosi gerai viskas.
Tai va, sterilizuotos katės iš tikrųjų remiantis įvairiais statistiniais duomenimis, katės sudaro vos ne 80% visų kačių laikomų namuose ir šiaip sterilizacija atneša ir tam tikrų iššūkių, į kuriuos būtina atsižvelgti. Tai yra viršsvoris, dėja, bet dažnai kačių sterilizacija lydi nutukimas ir jeigu nėra koreguojama katės dieta po sterilizacijos, tuomet susiduriame su tiesiog viršsvorio problemomis. Ir sterilizacijos metu pašalinami yra lytinių hormonų šaltiniai ir dėl to sulėtėja medžiagų apykaitos greitis, sumažėja energijos poreikis ir todėl katės, kurios yra šeriamos lygiai tokia pačia dieta kaip ir prieš sterilizaciją, 100%, beveik 100% priaugs svorio, nes realiai sterilizuotoms katėms reikia tik 75–80% maisto, kurio reikia visoms katėms iki kol jos buvo sterilizuotos. Tai todėl būtent į tai reikia būtinai atsižvelgti. Kas padeda išvengti viršsvorio sterilizuotoms katėms? Tai pašaruose dažnai yra naudojamas L-karnitinas, tai yra natūraliai randama amino rūgštis, kuri yra atsakinga už riebalų metabolizmą. Ši amino rūgštis funkcionuoja kaip riebiųjų rūgščių pernešėjas į mitochondrijas. Tai L-karnitinas šiaip yra natūralus IV grupės vitaminus panašus junginys, kuris padidina ląstelių membranų pralaidumą riebiosioms rūgštims. Ir būtent L-karnitinas padeda transportuoti šias rūgštis į mitochondrijas, į pačias ląsteles, kuriuose jos yra panaudojamos energijai gauti. Tai sakykime, pagrindinė L-karnitino funkcija yra riebalų oksidacijos stimuliavimas. Ir dėl to riebalai yra greičiau sudeginami ir neleidžiama jiems kauptis organizme. Šalia L-karnitino, sakykime, yra būtinos augalinės skaidulos. Šiaip augalinės skaidulos gali būti tirpios, gali būti netirpios. Šiaip ideali proporcija yra 3:1, tai yra netirpios prieš tirpes. Čia taip pat netirpios skaidulos atlieka didesnį vaidmenį, nes reguliuoja katės svorį, būtent juose esantis netirpūs pluoštai, nes jie gali sulaikyti šiek tiek vandens ir jie nesudaro klampaus tirpalo su vandeniu, priešingai nei tirpūs pluoštai. Tai čia maždaug, kad įsivaizduoti, kad būtent tos netirpios skaidulos, sakykime, yra toks kaip balastas skrandžiui, žarnynui, kur duoda sotumo jausmą katei. Katė ėsdama tiesiog greičiau tą sotumą pajaučia, ilgiau sotumo jausmas užsilaiko, bet būtent dėl tų netirpių augalinių skaidulų nėra suteikiama papildomai katei nereikalingų kalorijų. Ir būtent jeigu žiūrėti į kokie ingredientai daugiausiai turi skaidulų ir tame tarpe netirpių skaidulų, tai yra vėlgi kokosas, tai yra linų sėmenis, tai yra avižos, ryžiai, kviečiai, kviečių, sakykime, luobelės. Tai būtent tai yra tie ingredientai, kurie savo sudėtyje turi labai didelę netirpių skaidulų dalį ir dėl to jie yra labai naudingi būtent kačių pašaruose ir būtent tų kačių, kurios yra sterilizuotos. Taip pat sterilizuotos katės potencialiai turi šlapimo problemų po sterilizacijos, nes jos yra fiziškai mažiau aktyvios, mažiau laka vandens ir dėl to rečiau šlapinasi ir būtent šlapimas ilgiau užsilaiko šlapimo pūslėje, visoje šlapimo sistemoje ir dėl to, sakykime, visa ta sistema tampa labiau šarminė ir tai yra būtent sąlygos struvitiniams akmenims atsirasti. Ir būtent struvitinių akmenų problema yra viena iš didžiausių problemų, su kuriomis gali susidurti sterilizuota katė, Vėlgi, jeigu nėra atsižvelgiama į būtent mitybos pakeitimą po sterilizacijos. Ir tam, kad išvengti būtent tų struvitinių akmenų susidarimo, reikia turėti omenyje, kad yra tam tikros medžiagos, tai kaip diolmetioninas, kuris rūgština šlapimo sistemos terpę ir neleidžia susidaryti struvitams. Tai būtent, kaip ir minėjau, po sterilizacijos dažnai ir dėl pasikeitusių hormonų, ir dėl mažesnio aktyvumo, dėl to, kad ilgiau užsilaiko šlapimas, pati šlapimo takuose esanti terpė šarmėja, tai ją būtina rūgštinti. Tai būtent diolmetioninas ir yra ta priemonė, kuri sureguliuoja pH ir leidžia, sakykime, arba užkardo būtent tų struvitinių akmenų susidarimą, nes tiesiog jie nebeturi terpės augti. Toliau gliukozaminas šunų pašarės, šiaip irgi labai svarbus ingredientas, nes šiaip gliukozaminas yra sudarytas iš glutamino, tai yra amino rūgšties, ir gliukozės, tai yra cukraus, ir šuns organizmas natūraliai pasigamina gliukozaminą, ir tai yra medžiaga padedanti sukurti molekulės, kurios būtent sudaro šuns sąnarių kremzles. Ir gliukozamino sulfatas yra plačiai rekomenduojamas kenčiantiems nuo sąnarių problemų, ypač osteoartrito. Taip pat yra vienas iš labiausiai paplitusių nevitaminų, nemineralinių maisto papildų tiek šunims, kaip žinome, ir net ir žmonėms. Ir gliukozamino natūraliai galima rasti gyvūnų kauluose, kaulų čiulpuose, todėl nedideliais kiekiais jo yra visuose mėsos pagrindų pagamintuose šunų pašaruose. Dėl to, tarkim, irgi renkantis šunų pašarus labai svarbu atsižvelgti į tai, kokie yra būtent gyvūninės kilmės šaltiniai. Ir nepaisant to, kad daugelį šunų ėdalų, ypač skirtų vyresniems šunims ar didelių veislių šunims yra pridėta gliukozamino, tai būtent dėl to, kad jie yra vyresni arba dėl to, kad jie yra didelių veislių, dėl to pas juos poreikis atsiranda būtent didesnis gliukozamino ir šunų pašarai yra praturtinti papildomais gliukozaminais arba jeigu to neužtenka būtent iš tų ingredientų, kurie yra naudojami kaip gyvūninės kilmės šaltiniai pašaruose, toliau papasakosiu apie tai giliau. Ir gliukozamino naudos, tai yra iš principo padeda sutepti šuns sąnarį ir sumažina skausmą, pagerina bendrą šuns sąnarių būklę, palaiko šuns aktyvumą, būtent dėl to, kad, sakykime, mažiau šuo jaučia skausmą, ypač jeigu jautė prieš naudojant gliukozaminą, padeda gydyti stuburo disko pažeidimus, padeda greičiau atsigauti po sąnarių operacijos ir mažina sąnarių uždegimą. Šalia gliukozamino taip pat yra svarbus ir chondroitino sulfatas šunų pašare. Ir kaip nors gliukozaminas yra naudingas šunų sąnariams, tai nėra vienintelis junginys, kuris gali padėti. Tai chondroitino sulfatas padeda išlaikyti natūralų šuns sąnario tepimo storį. Ir chondroitinas taip pat palaiko sąnarius ir yra dar vienas svarbus kremzlės statybinis blokas. Ir būtent chondroitinas kartu su gliukozaminu gali maksimaliai pagerinti sąnarių būklę, užtikrinti gerą šuns judėjimą ir mobilumą. Chondroitino sulfato šunų pašare, tai irgi jisai, kaip ir minėjau, padeda išlaikyti natūralų šuns sąnarių tepimo storį. Chondroitinas taip pat palaiko sąnarius ir yra dar vienas svarbus kremzlės statybinis blokas. Ir gliukozaminas kartu su chondroitinu, nes tarkim, jeigu bus vien tik tai gliukozaminas, bet chondroitino trūkumas, tai nebus pasiekta maksimali teigiamas efektas, tai būtent jie turi veikti kartu gliukozaminas ir chondroitinas. Ir kokiems šunims rekomenduojamas gliukozaminas ir to pačiu chondroitinas, tai yra būtent didelių veislių šunims, nes jie tiesiog potencialiai dėl savo didelio svorio turi didesnės apkrovas sąnariams, taip pat aktyviems šunims, tai vėlgi ta pati, sakykime, ta pati problematika dėl to, kad jie aktyvus ir vėlgi didesnė apkrova sąnariams ir šunims seniorams, nes tiesiog jie jau dėl senėjimų procesų, dėl lėtesnės apykaitos potencialiai organizmas nebesugeba pats tiek natūraliai pagaminti gliukozamino. Omega 3 ir omega 6 rūgštis šunų ir kačių pašare, šiaip irgi labai svarbus komponentas renkantis pašarą. Ir omega 3 šiaip sudaro alfa linoleno rūgštis, tai yra natūraliai randama augalinėme maiste. EPA, tai ekozapenteno rūgštis dažniausiai randama jūrinėme maiste. DHA, tai yra rūgštis, kuri randama irgi taip pat dažniausiai jūrinėme maiste. Omega 6 sudaro linono rūgštis, kuri šiaip randama riebioje žuvyje ir mėsoje. Ir arachidono rūgštis, kuri taipogi randama riebioje žuvyje ir mėsoje. Jeigu renkantis irgi šunų pašarą ir žiūrint, kokia tai yra proporcija omega 3 ir omega 6, tai vėlgi rekomenduojama 10:1 ar 5:1, būtent daugiau omega 6, mažiau omega 3. Tai nes, tarkim, netinkamas balansas irgi gali atnešti ir tam tikrų neigiamų aspektų augintinio sveikatai. Kodėl svarbios omega 3 ir omega 6 rūgštis? Tai palaiko smegenų veiklą, nes omega 3 dažnai net ir vadinamas smegenų maistas ir būtent DHR ir EPA yra ypač naudingi smegenų sveikatai. Smegenys šiaip susideda iš maždaug 12% pilkosios medžiagos, kurią taip pat sudaro ilgos grandinės riebalų rūgštis, ir ilgos grandinės omega gali padėti atkurti šias pilkąją medžiagą ir pagerinti visų amžiaus grupių naminių gyvūnų pažinimo sveikatą. Ir tai ypač svarbu, gal sakyčiau, puppy periode, junior periode, kada šuo dar, sakykime, vystosi, visas smegenų veikla vystosi, šuo turi daug išmokti, daug mokosi ir būtent tinkamas kiekis omega rūgščių yra būtinas. Ir čia, aišku, labai svarbu nepamiršti ir būtent jau seniorų šunų, kada šuo dėl savo lėtėjimo proceso po truputį praranda savo kognityvinės funkcijas, visą tai, ką jisai išmoko per savo gyvenimą. Ir būtent omega 3, omega 6 riebiosios rūgštys maitindamos smegenis būtent prailgina tas kognityvinės funkcijas ir prailgina kokybišką šuns senėjimą ir šuns gyvenimą. Taip pat omega šios rūgštys yra ypač naudingos dėl sąnarių veiklos, nes padeda kovoti su uždegimu ir padeda sąnariams, būtent jeigu, tarkim, kažkokios tai kyla sąnarių problemos. Taip pat omega 3, omega 6 nepamainomos būtent užtikrinant gerą kailį, gerą kailio odos būklę, nes būtent tai gali įtakoti ir kailio spalvą, pašviesinti pablukusi kailį, sumažinti, pagražinti arba, sakykime, šiek tiek pariebinti sausą odą, sausą kailį, užkardyti niežtinčios odos problemas. Tai būtent tai irgi svarbu atsižvelgiant, renkantis ar rekomenduojant, tarkim, jūsų klientams pašarą. Čia trumpai apie mūsų produktus. Ko gero jau daugelis irgi esate girdėję apie Patro super premium sausus pašarus. Vėlgi mes kurdami receptūras atsižvelgiame į šuns mitybos poreikius, į visas galimas maisto netoleravimo rizikas ir stengiamės maksimaliai parinkti tokius ingredientus, kurie atneštų visas reikalingas naudas, kurios reikalingos išlaikyti gerą augintinio sveikatą. Mes šiuo metu turime begrūdę liniją Patro Regular, viršuje matom tas visas pakuotės ir apačioje turim rudos pakuotės Small Breed produktų liniją skirtą mažų veisliniams šunims, kuri yra visiškai begrūdė. Visos Small Breed linijos privalumai yra tai, kad mes kiekvieną granulę padengiame su šaltai džiovinta natūralia mėsa, naudojame viso gyvūno mėsą būtent visavertei mitybai ir, kaip ir minėjau, Small Breed linija yra be grūdų. Čia dar dėl visavertės mitybos, tai vėlgi grįšim prie to paties, ką aš pasakau apie gliukozaminą. Kaip ir sakiau, gliukozaminą galima gauti per šunų pašarą, šeriant pilnaverčiais gyvūniniais baltymais ir mūsų pašarai yra gaminami naudojant arba laikantis full source technologijos. Tai reiškia, kad mes dedam gyvūninės kilmės ingredientą į pašarą, mes neatsirinkam tik tai tam tikrų gyvūno raumenų dalių, tai yra ten nededam tik tai raumens arba nededam tik tai filė, mes dedam visą gyvūną, įskaitant ir kaulus, įskaitant ir korpusą, įskaitant ir kremzlės, ir būtent visi tie dalykai atneša visiškai natūralias vertės, būtent tokias kaip gliukozaminas, chondroitinas, ką minėjau prieš tai, kas yra labai svarbu, ir būtent dėl to, kad mes dedam visą gyvūną, mums jau nereikia jo praturtinti pašaro papildomai, sakykime, cheminiais gliukozaminais, nes mes tą gauname būtent iš įdėtos mėsinės dalies. Omega šaltiniai jūrinės kilmės baltymuose, tai vėlgi mūsų small breed linija, kai mes kūrėm receptūrą, stengiamės, kad būtų maksimaliai praturtinta reikiamam omega-3, omega-6 rūgštimis, ir kaip minėjau, tų rūgščių gausu yra kokybiškoje žuvyje ir jūrinėse produktuose, todėl mes gausiai naudojame lašišą, naudojame baltą žuvį ir, kas svarbiausia, mes naudojame akrilį. Tai vėlgi visi tie ingredientai, visos tos gyvūninės kilmės baltymai yra full source, tai yra mes dedam visą tą, sakykim, žaliavą, tai atneša vėlgi tai natūralius gliukozaminus, natūralius chondroitinus. Ir čia, ko labiausiai, sakykim, didžiuojamės, tai yra būtent full source 100% antarktinių krilių, kuriame yra gausu ilgos grandinės omega-3 riebalų rūgščių, ir būtent irgi, kaip ir minėjau, tai yra ir stiprus antioksidantas, ir būtent ateinantis iš aukštos kokybės jūrinių baltymų. Ir tai yra labai palanku augintinio sveikatai, nes tai būtent natūralus omega-3, omega-6 šaltinis. Taip pat savo asortimente turime produktą visiškai pritaikytą sterilizuotoms katėms. Kaip ir minėjau, sterilizuotos katės potencialiai turi problemų su šlapimo takuose augančiais turvitiniais akmenimis. Dėl to mūsų pašare irgi kai kuriam receptūrą atsižvelgiam į tai ir sureguliuoti šlapimo pH, tai yra jį parūgštinti, mes naudojame delmetioniną, ir būtent tokiu būdu mes galim užkardinti struvitinių akmenų atsiradimą. Taip pat tam, kad katės neturėtų problemos dėl viršsvorio, kalbėjom apie tai, kad po sterilizacijos visos, daugelis kačių turi problemų dėl viršsvorio, tai mes savo sudėtyje naudojam letiną, kuris padeda metabolizuoti riebalus, kuris daro greitesnį medžiagų apykaitą, ir taip pat mes gausiai naudojame augalinės skaidulas, kuriuose yra daug netirpaus pluošto, ir kaip ir minėjau, būtent jisai padeda pajausti katei greičiau sotumo jausmą, taip pat padeda katei ilgiau išlaikyti tą sotumo jausmą, ir tokiu būdu, sakykim, katė gauna pašaro, negaudama papildomai nereikalingų kalorijų. Tai iš mano pusės trumpai būtų tiek. Jeigu kažkokių kyla klausimų, tai galima paklausti arba parašyti elektroniniu laišku. Aušros, ir aš paskui atsakyčiau.
Ir jei neturime klausimų, tai visiems gero vakaro ir ačiū už dalyvavimą ir tokį gausų susirinkimą ir išbuvimą iki pačio galo. Tai vadinasi, seminaras tikriausiai buvo įdomus ir gavote bent jau kažkokių žinių. Viso gero visiems, iki kitų susitikimų.
Viso.